More than 81,000 people across the UK are living with secondary, advanced or metastatic breast cancer. Although the disease can no longer be cured, there are treatments that can keep the cancer under control, allowing patients to experience a good quality of life, sometimes for many years. Support from family and friends is crucial, but often they just don't know what to say or do. We've created 5 different characters who give voice to quotes from a survey done with more than 100 patients who are currently living with advanced breast cancer. They reveal the different things that their families and friends did or said which are more or less helpful, practically, socially, and emotionally.
I'm Sophie, I've got 2 kids and I was diagnosed with breast cancer that's already spread.
I'm Sue, I've got a big family who I spend all my time with. We do everything together. I thought I got over breast cancer 8 years ago, but it's come back and it's spread.
I'm Mary. I have advanced breast cancer, which has spread. My husband died a while ago, and my children live quite a long way away. And sadly, my friends aren't in great health themselves.
I'm Andrea. I've had breast cancer for 3 years, and now it's recurred, and this time is advanced. My career had been going so well.
I'm Adila. I've lived here in the UK for 20 years with my wonderful family. I love cooking for them and looking after my grandchildren. But I'm not sure how I'm going to do that now I have advanced breast cancer. It's in my bones and in my lungs.
Leslie, Stephen, thank you so much for joining me. We're going to be looking at some examples from real patients about what their family and friends did that helped or hindered when they had a diagnosis of advanced breast cancer, which you yourself have had as well. So your comments are going to be extremely valuable.
No, thanks. I'm happy to be here and share my experiences.
Now, patients may share the same diagnosis, but their reactions to it are obviously going to differ, as do those of their family and friends. And I think this is often because they just don't understand what a diagnosis of metastatic breast cancer is. So, shall we hear some examples of that?
My son lives quite a long way away, and he keeps saying that it'll be all right. He just doesn't want to acknowledge how serious and worrying a metastatic diagnosis really is.
Most of the family offer platitudes like, you're strong and you can beat this, you've beaten it before.
It isn't kind to be told about people who have survived cancer. It means they don't understand that stage 4 is incurable. But then I don't like hearing about people who died either.
One friend rang and asked me when my treatment would be over. She kept saying things like, well, you've beaten it once before. I had to tell her, my cancer is treatable, but it's not curable.
Someone asked me how I didn't know that I had breast cancer so long that it had spread before I got the diagnosis. That just made me feel so guilty.
Leslie, perhaps we should start with an explanation about some of the terminology being used here. Most patients will be diagnosed with early forms of breast cancer, which can often be cured. But some of those are going to recur and spread to other parts of the body, by which time it's known as advanced, secondary, metastatic or stage 4 breast cancer. And this is what's getting confusing for many people, because although this can still be treated, it's no longer curable. Now, unfortunately, as you know only too well, some patients are diagnosed with advanced forms of breast cancer as their very first diagnosis. I wonder if you could share a little bit about your own experiences with that.
Yes, of course. Well, I was diagnosed completely out of the blue, de novo, as it's called. I'd been feeling very, very tired. I had a cough that wouldn't go away, and I'd been to my GP several times. Eventually saw a GP that took it quite seriously. I was sent for a chest x-ray and an urgent CT scan, and then was given the devastating news that I didn't have a chest infection or adult onset asthma, which I thought I had, but instead it was secondary breast cancer that had already spread to my liver, my lungs and my bones. And I was plunged into a very deep, dark place, grief-stricken at the loss of all those kind of milestones that other people and that I had taken for granted.
How devastating.
Yeah.
And doubtless your family and friends found it equally hard.
Yes, I think it was an enormous shock to people, and they also took a while to understand that I would never be cured and that I would be on treatment for the rest of my life.
Thank you for sharing that with us, and perhaps we should move on and listen to some of the experiences that our patients have told us they've found that their own family has had difficulty in dealing with when they've heard news such as yours.
Some of the family members have just withdrawn. They don't want to know because it's too hard for them.
Some of the family get hung up about the negatives. Others keep telling me to be positive. It's hard dealing with their different emotions when I've got my own to deal with.
My partner has completely buried his head in the sand. He doesn't really support me emotionally, or he just doesn't want to talk about anything. I think it would have been helpful for someone to explain to him just how scary it is for a mum to know that she might not be alive to see her kids grow up.
My sister is not willing to talk about the end of life. And I find this very frustrating because I have to discuss it with someone.
I hate seeing the worry on my family's faces.
I write a blog, and a few of the family members have told me they stopped reading it now.
My brother keeps asking me how many months I have left to live, like I'm going to drop down dead. I do start to worry more after I've seen him. I want to stay hopeful.
Leslie, your own feelings must be very hard to handle because they're going to fluctuate always between sometimes being positive, sometimes feeling pretty negative.
Yes, I mean, it's a bit of a cliche, but it is a roller coaster of emotions. When the treatment's going well and the cancer is stable, you can sometimes almost forget that you're living with cancer. But you also have to live your life in 3 or 4 month chunks of time, because you get regular scans to see how the cancer is doing. And patients talk about scanxiety, which is the anxiety you feel in the run-up to a scan and to receiving those results. And it can be very difficult just living with that constant uncertainty and ambiguity.
What about when your family, with the best will in the world, try and reassure you that they're sure it's going to be all right each time?
I mean, I hate it when they do that. I really do. When people say to you, you'll be fine, I know so-and-so who lived years with advanced breast cancer, it's really not at all helpful, because while you want to stay hopeful as a patient, you need to be realistic as well. This disease cannot be cured. It's almost like they're trying to be hopeful and positive for themselves rather than for the patient, and they just can't deal with the diagnosis.
Well, let's hear actually some examples that our patients told us that their family did that were more useful emotional responses.
My husband is always there with big hugs, and he's ready to listen when I'm upset.
My daughter listens and shows that she loves me. I am very lucky.
My sister's amazing. She just listens to me talking about my cancer. She doesn't ignore it.
2 of my siblings talked through a lot of emotional end-of-life stuff with me, and that really helped. My brother even offered to shave my head if I needed to have chemo again.
I love it when my grandchildren keep me posted on life outside my cancer world.
So we heard an interesting combination there of emotional responses that were valued with a little bit of practical support as well that we'll discuss later. But I was really interested in how many patients talked about the importance of just listening, allowing you to talk. Can I ask you a question though about when family are listening to you, telling them how you feel or how tough it's been, and they get upset, does that actually inhibit you from finding anyone that you can be honest with?
It can be difficult. I remember when the cancer moved into my brain, which was an awful time for me. My elderly dad, his wife, my mum, also died of cancer, and I can remember having to try and put on a very brave face in front of him, even though I knew that was a pretty devastating diagnosis, so that he didn't get upset and think that I was about to die. So sometimes as a patient, you protect other people.
Now, unfortunately, Leslie, some of our patients don't have a lovely, warm, supportive family on who they can depend and share their problems with. So friends are going to become vital in that situation. Let's listen to some of the things that, again, our patients have told us that friends have done.
It feels like my cancer's like this elephant in the room. You know, no one knows what to say, and so some friends have even just completely disappeared.
Some of my friends avoid using the C word. They ignore my cancer and they can't talk about it. They don't write or message or even ask how I am. But then, when people do ask me how I feel and how I'm coping, I just burst into tears.
One colleague that I used to be friendly with tells me how busy they are and how nice it must be for me to have time off work.
I was really sad seeing 2 friends cross the road, so they didn't have to speak to me. I know they saw me.
Other friends keep telling me how brave I am, which is awkward because I feel anything but. And that closes me off from being honest about my emotions.
At first, there was lots of attention, consideration, help, cards, visits. But now, my friends have just slipped away.
Well, many of my friends aren't very well themselves, but, saying things like, oh, we could both be under a bus tomorrow, or you look really well, when I feel awful, well, it doesn't help.
I became aware of a WhatsApp group with my friends in where they were discussing things, including my condition. I found that really isolating.
So we've got quite a few things to unpick there, and we saw that reflected in the quotes. Sometimes patients find that their friends just cannot handle the sadness of it all. Let's face it, it's a desperate situation to be in, and they drift away. But of course that can make you as the patient feel neglected and abandoned. Why don't we actually see some of the more positive things that friends actually have done?
Seeing a friend who had the same diagnosis really helped. She listened to my fears when I didn't want to burden the family.
I so value those friends who just give me a text or come over and cheer me up. They'll give me the biggest hug and just make sure I'm okay when I don't want to cry in front of my kids.
Just being there for me. Listening, laughing, crying. It's just so important.
An old school friend who also has secondary breast cancer got in touch through an online forum, and just talking with her has helped enormously. She always asks how I am, and she keeps on asking, knowing how things change.
I am so grateful for friends who pray for me.
I value people who listen, empathise, plan trips out, and share meals with me.
Sometimes I don't need friends to do things, but I like having some who feel comfortable just listening.
I appreciate people treating me as normal and not as if I'm about to die.
Here we go again. It's sometimes easier said than done, but just as with the family, our patients were telling us how important it was for friends to sometimes act as normal. But how can you act as though everything's normal when in fact it isn't anymore? I guess that's the tricky bit. One of our patients mentioned how valuable it had been to get in contact via an online forum with somebody who'd been living the same experience as her. Can you tell us a little bit about your advocacy experience?
I think the only people who really get it, who really understand, are the other ones who are living with the disease. And I think the best thing I ever did at the beginning, when I was first diagnosed, was to join a face-to-face support group organised by one of the cancer charities. And I met some amazing women in that group who could give me advice on dealing with the side effects of the treatments. And we also just had a laugh.
Now, even though they might care deeply, it's quite clear that many family and friends just can't give the right sorts of help or the right sorts of things at the right time. And that's where the online forums and patient support groups really come to the fore. But one of the things we were very struck by with our survey was how many patients told us that family and friends kept giving them well-meaning but often inaccurate advice.
You'd be amazed at how many well-meaning friends provide daft advice of quick fixes or things like, oh, a change of diet's going to cure you.
Although my son asks lots of questions, he doesn't listen to the answers. And then he tells me what to do.
My husband does not consider that my life has changed and expects me to carry on as normal. Well, that's okay to a point. But there are times when I feel that I need more support from him. He doesn't listen to me.
My sister-in-law says really guilt-inducing things, like it's all psychological, or if I changed my diet, if I ate only almonds or had an alkaline diet, then I would be cured.
At times, they can just be too protective. I hate those words now. Take it easy. Like I'm fragile. I know my limits. I know when I need to rest.
Well, Leslie, we've got two issues essentially to deal with there: being wrapped in cotton wool by everyone or being sort of advised about miracle cures. Let's deal with the overprotectiveness first of all. I mean, how do you handle that when people, again, are only trying to help?
Oh, it is difficult. I mean, some of the comments from those other patients really resonate with me. The drugs do cause quite a lot of fatigue, though, as well, and other side effects. But I really don't like to be told what to do or told to take things easy. I think I know myself well enough to know when I do need to take a rest. So it's not helpful when people try and... I know it's for the best of intentions, but when they try and tell you how you should behave.
So, Leslie, that's interesting what you've just said, but how is somebody meant to know when, you're going to need help or rest up, when you're trying to do too much?
That's difficult. I think it's how much empathy you have, how well your friend knows you. What most patients don't want is that kind of side tilt of the head saying, how are you? And that sense of pity, which really is not at all helpful.
So just actually ask for help when you need it, and be quite clear when, you just don't want people to assume. We keep coming up against this, people making assumptions about what's going to help. Could we now deal with this other thing that crops up all the time? That's well-meaning friends and family who just don't believe, essentially, the diagnosis and search for miracle cures via Dr. Google or on the internet.
Yeah. So I think, again, that's something that's very, very common. I've had people coming up to me, people that I barely know, to be honest, saying, have you given up dairy yet? You must do that. Whereas I know now, I maybe didn't at the start, but over time I've learned that it's really the drugs and the treatments that keep you well, and looking after yourself, just basic good nutrition, a bit of exercise and so on. But, going into a hyperbaric oxygen therapy session or an infrared sauna is not going to cure my cancer.
That's interesting, because I think sometimes what people are demonstrating when they're trying to be helpful, sending you all these things that Dr. Google has suggested on the internet, they're probably demonstrating that they too cannot believe that there isn't something out there that could help you, and cannot cope with the thought that you are likely to die of this disease now. So I think it's well-meaning, but probably not a good idea. Now, there comes a time when, of course, your situation will demand that you seek some practical help from family and friends. So shall we see a few examples of what patients have told us they have really, really valued being offered?
It's hard for me to accept sometimes, but practical things really help now, like lifts to appointments, or my sister often cooks and puts things in the freezer for me. That's really helpful.
Some friends help with the nursery and school run. One friend even looks after my baby when I have counselling, and she lets me talk about the session afterwards.
My sister always encourages me to do what I can and helps me when I can't.
A friend of mine who I used to work with takes me for drives. She gets us shopping. She sends me messages. She takes the dog for a walk when I can't.
Sometimes my parents will take the children overnight. They're also helping us out financially.
One friend, with my permission, has shared my diagnosis with our group of friends so that I don't have to repeat it to each individual person.
One amazing thing that my friends have done is raise some money so we can go on a short trip as a family and make some beautiful memories.
My daughter also comes to the consultations with me, and she writes down everything that is said so that I can read it later. And she asks questions, and sometimes she asks questions that I forget to ask or am too scared to ask.
My sister still comes round with meals she's cooked for us. She puts them in the freezer. And during the chemo days when I was really poorly, and I was really struggling. She offered to clean the house, and I said, yes, please.
So we had a wide variety of things there from people about things that would help them practically as their situation inevitably changes. I wonder if you could summarise for us, Leslie, some of the key points, the things we've heard from patients really stand out for you when their family and friends just don't know what to say or do.
I think one of the most important things is just to listen and to recognise what the patient is feeling at that moment in time, because as you say, it changes over time. Try and walk in their shoes, try and put yourself in their situation. Don't minimise the diagnosis. That's one thing that really bothered me when people would say, well, you know, you're going to live forever, or we could all get thrown under a bus at any point. Please don't do that. Recognise that this is a really serious disease that people are having to cope with, not just physically, but mentally. And just be there for them. Just let them know that you'll be by their side through thick and thin, and there to support them either practically when they need that practical support or emotionally.
Leslie, thank you very much for sharing your valuable insights into what family and friends can say and do.
Thank you.
What they say and do could make all the difference.